Hi, I'm Jennifer, one of the occupational therapists that work at the hospital. Today I'm going to review with you some important information related to your hip surgery. Following your hip surgery, you have 3 hip precautions that you need to follow for 3 months to prevent a dislocation of that new hip. The first precaution is no bending past 90 degrees. So you can't bend down like this or bring your operated knee higher than your operated hip like this. That includes both in sitting or standing. You also cannot twist at the hip, and you can't cross your legs at the knees or the ankles in sitting, lying, or laying down. The other thing that's really important related to these hip precautions is looking at the environment of your home, checking all the places that you're going to sit to ensure that the surfaces are higher than your knee. So when you look at your home, you need to make sure that all the surfaces you're sitting on are high enough related to those hip precautions. So just imagine that there is a line at the top of your knee joint, and everything that you sit on needs to be higher than that line. So with a chair, you might need to add a cushion or raise it up from the bottom. Your bed, you may need to raise up with an extra mattress or again with blocks. And then your toilet, you will need a raised toilet seat or a commode. So I'm going to review with you how to get dressed after your hip surgery. There's some equipment that you'll need to have at home. So this is called a reacher. This is really important. It helps you not bend over when you need to get dressed. So the reacher can be used for a variety of things. First off, I'm going to show you how to remove my shoe and sock with it. So we'll pretend my operated leg is my right leg. I'm just going to slide the shoe off using the shoe horn and put it to the side. And I'm going to also slide my sock off using the little end of the reacher. So we're going to talk about how to get your sock back on. So I'm going to grab my sock off the floor of the reacher. And we're going to use a device called a sock aid. In order to put the sock on, you're just going to place this on your lap and take the heel part of the sock, put it against the hard plastic, and pull the sock over until it reaches the end. And then just toss that down to the floor, slide your foot in, pull up, and the sock can go on. In terms of shoes, you want to have something nice and easy to put on. So I've got slip-on shoes, which is ideal. I can just line these up with my foot, lift my foot up and in. If I'm having any trouble at the back, I would use a shoe horn. And you can get those nice and long handled as well. I'll take off my other shoe because I'm going to demonstrate how to put on pants now. So you want to have pants that are a little bit loose so that they slide easily up over your incision. To get dressed, you're going to grab the waistband of your shorts or pants with this reacher, pull back on the trigger to tighten it, and just drop it down to the floor. Lift that operated leg into the shorts, bring it up to your knee, reach for it, grab the other side, bring it down, and then just pull it up. It does take patience because sometimes it's a little hard off the start, but it gets easier with time. Once the shorts are up, you would want your walker in front of you. Then you're going to push up from your chair, stand up, and pull those shorts up. To take them off, you're just going to slide them back down. Reach back for your chair, sit down with that leg out a bit in front. Use the reacher and slide the shorts off. We generally recommend that you sponge bathe after your surgery for the first little while. If you have a walk-in shower, once your staples are removed, you can go into that. If you have a tub, you should wait at least 6 weeks, and you may need some equipment in there to make it safe for you to get in and out. The information on getting in and out of the tub is in more detail in the pamphlet. You want to go in the front passenger seat of a vehicle. You want it set up by the driver so that you've got lots of leg room, so the seat needs to be pushed back as far as possible. And you need to recline the backrest to about a 45-degree angle. If you have bucket seats in your vehicle, you want to fill in the bucket with a rolled up towel or a pillow. And we recommend putting a garbage bag on top of that just to make you slide easier. So you'll back up to your vehicle, you'll sit on the seat, and then swing yourself in. You may need some help from your caregiver with your leg, and just to get you into the car. To get back out, you would swing out and then stand up from there and go on with your walker. Any more information that you might need is located in this pamphlet.